Good afternoon. My name is Stephanie Bostic and I am a student at the Mississippi University for Women. I will be filming my full body assessment for our class. This will be Sarah Beasley. Sarah Beasley will be our patient today. Good afternoon, Ms. Beasley.
Hello.
I'm going to do a full body assessment on you, but prior to me getting started, do you have any health concerns or issues that you have been experiencing lately?
No, I'm just here for my checkup.
All right. Are there any genetic issues that you need to discuss or think that might cause any problems with our assessment today?
No.
Great. I'm going to go ahead and wash my hands to get started. Now, to get started, I'm just going to inspect your skin. I don't see any abrasions or lesions, so everything looks good. Have you been having any problems with your skin?
Mm-mm.
Okay, great. And I'm just going to tilt your head so I can look at your scalp. All right. Any dryness or any problems there? All right. And we'll just look at the symmetry of your eyes and of your ears. I'm going to place my hands here and turn your head. Give me resistance. Okay, and we'll turn the other way. Great, thank you. Now, as far as your nasal area, have you had any problems with that lately with the change of seasons?
No.
Okay, I'm going to get you to open your mouth and say ah, and I will assess your gag reflexes in your throat and your tonsils.
Okay.
Very good, thank you. You still have your tonsils, I see?
I do.
I'm going to go ahead and inspect your teeth. If you don't mind, go ahead and give me a smile and kind of grit those teeth. Put a little air in your cheeks. Okay. I'm going to go ahead and assess your thyroid. Please swallow as I... Okay. As you'll see, about 20 feet away from you, you will see a Snelling chart.
Mm-hmm.
That's an eye chart that we use to test for visual acuity. Could you please read the smallest line that you're able to see?
PEZ0,
Okay, great. And I'm just going to check your pupillary reflexes. We're going to test your hearing with a tuning fork. What this will do is you'll be able to feel, hear, and sense the vibration.
Okay.
Please let me know when you can feel the vibration.
I feel it on both sides.
Okay. And I'm going to put this on the bone behind your ear. Let me know when you feel it.
I feel it.
For one last test, I'll put it to the side and let me know when you hear it.
I hear it.
I'm going to stand approximately 2 feet away from you and whisper. As I do that, please let me know when you can hear me.
Okay.
Sarah?
I hear you.
Okay, great. And I'll assess your nose. We're going to test your senses. As you close your eyes, let me know when you feel the cotton.
Feel it. Feel it. Feel it.
All right. Now, while you're sitting, I'm going to go ahead and assess your abdomen.
Okay.
Well, I'm sorry, I'm going to assess your posterior back, okay?
Okay.
Do you feel anything, any tenderness, any areas of concern? I'm going to place my hand in a small fist, and I'm going to press it against your kidneys. Let me know when you feel it, okay?
Okay. I feel it. Feel it.
Any tenderness?
No tenderness.
I'm going to go ahead and listen to your lungs. I'm going to go under your blouse. Is that okay?
Sure.
And take a deep breath. And another deep breath. You'll feel the flat palm of my hand against your bottom back as I just assess and feel for any problems. Very good. Let me assess your extremities, your upper extremities. I'm going to assess your pulses. This will be your brachial. This will be your radial. I'll also go ahead and assess your temporal pulses. Very good. I'm going to go ahead and listen to your heart. Are there any known heart issues in your family?
No.
You can go ahead and lay back, and as you lay back, I'll go ahead and begin assessing your abdomen. I'm going to lift up your shirt slightly. Are there any concerns regarding your abdomen or any painful menstrual cycles?
No.
Listen to all 4 quadrants of your abdomen. Now I'm going to palpate and percuss your abdomen.
Okay.
All right. Was there any tenderness or areas of discomfort felt?
No.
I'm going to help you lift up. Now I'm going to test your capillary refills.
Okay.
Less than 3 seconds. Are you having any circulation issues or noticing any spots that look like bruising on you anywhere? One last thing that I forgot to do with your eyes, if you could just look up to the right and look up to your left. All right. I'm going to help you up, and we're going to do some things with that lower extremity. If you don't mind, could you please take a few steps that way on your tippy toes? Very good. As you turn back around, could you please make sure you walk back towards me on your heels? Very good. Now, when you do that, could you go ahead and put your arms up forward for me? And let's touch our nose. Can you do that also while walking?
Mm-hmm.
Very good. Your coordination is wonderful. Could you? With our arms, can we put them up and to the side and to your posterior? Are you noticing any discomfort, or is that a challenge to do? I'm going to test your reflexes. Let me know when you feel this.
I feel it.
All right.
Oh yeah.
All right, and I noticed your legs kicking up. As we complete our assessment, I'm looking at your legs. The skin seems fine. I see no bruising, no abrasions. I'm going to go ahead and test your pulses here. And your Achilles pulse. Could you go ahead and please give me resistance as your feet press down? Thank you. Can you rotate your ankles?
Mm-hmm.
Very good. Can you rotate your wrist? I'm going to lift this, and as I put my palm against your elbow, could you please give me resistance? Very good. And again, on resistance. Thank you. I will not be completing a breast exam today, but have you had one recently?
Yes.
And you had it at your annual pap smear?
Yes. Then I do my monthly breast exams as well.
Okay. And when do you do that? Should be
A week
around-
after my period.
Right. That's very good. Now, also, have you experienced or felt any lumps or had any problems?
No, never.
Do you have any genetic relations that have that on either your father or your mother's side?
No.
All right. Now I'm going to do one last thing where I'm going to open your palm and close your eyes, and I'm going to trace a number on the inside. Let me know what you feel.
3. 6.
Very good. And I'm going to go ahead and test your palms and your fingers. Lastly, I'm going to get you to close your eyes, and I'm going to place an object on the inside of your hand. Let me know what you feel.
Cotton ball.
Very good. And you can keep them closed one last time and just give me a vague description of what this is in your opposite hand.
Flat, some sort of package.
Very good.
Oblong.
That will complete my assessment today. Do you have any questions or additional?
I don't believe so.
Okay.
Thank you.
Have you had your water today? I do believe I assessed your thyroid, but let me just test and see how your swallowing reflexes
Okay.
are. Is there any pain associated with that? Okay. Well, that will complete our assessment. Do make sure that you do get a full body wellness assessment at least once a year.
Okay. Thank
Thank
you.
you so much for participating, and I hope that this assignment is acceptable, and this will conclude my assessment. Thank you.